All right, good evening, everybody, and welcome to this evening's webinar. My name is Josie Cooper, and I'm excited to be here on behalf of the Gout Support Group of America for a conversation around gout. So over the next hour or so, we're really here to talk about gout management and gout treatment. So we are very excited to have a couple of experts here to answer questions. I will note that we have lots of time for Q&A at the end. And so if you have questions, please feel free to drop those in the Q&A box and we'll ask those. And if you are watching on the Facebook Live, stream, drop your questions into the comments and we will get to those later in the program. But before we get started, I'd like to spend a minute introducing our two speakers tonight, GSGA's co-founders, Dr. Chris Parker and Gary Ho. I'll let them both tell you a little bit about themselves. And Dr. Parker, I'll turn it to you first.
Sure. Chris Parker, I'm a rheumatologist. I became a rheumatologist in 1997, so it's been a little while. I developed a special interest in gout way back then when I was in the Army at Walter Reed. And since then, I've done a lot of research in the area, published in the area, and then Gary and I founded the Gout Support Group of America to really bring, education and support to, people all over the English-speaking world here on Facebook.
Awesome. Gary Ho, I am a patient of gout since 1994. So I experienced my first gout attack when I was 24 years old. It took me 16 years to finally receive a diagnosis. Experienced a lot of just, medical gaslighting, I guess, doctors not taking what I'm saying to heart, dismissing my pain. And I had to revert to a lot of over-the-counter management of gout, right? Over-the-counter medication and home remedies, which, it just didn't work. And I'm sure we'll get into that. But ultimately, I did find my way to Chris in 2010, and that was life-changing. Being able to meet a gout specialist that understands my disease and had a little bit of empathy. A little bit of empathy goes a long way. All that to say that we're here tonight to offer hope, right? I'm big. Chris and I are big on hope. The fact that we live with gout, there's no better time to live with gout. I mean, I guess, if there's a positive spin, there's no better time to live with gout than the period that we're in now, because we have so many tools that I'm sure we're going to touch on to be able to manage gout and to be pain-free. And it's good to be here.
Thanks so much, Gary and Chris. So with that, we want to dive into tonight's discussion. And we want to start with treatment. So, while gout is not curable, it can successfully be managed. And to your point, Gary, there's a lot of treatments available now, which is exciting. So, Gary, do you want to share a little bit more about your story, how you found the right doctor and treatment?
Yeah, so that 16 years looking for answers was a pretty dark period in my life. And I'm sure as I'm speaking to our audience, I'm not the only one that have been through or maybe currently going through the situation. Gout, for some reason, has many stigmas, right? More stigmas than I can really count. And I can't really compare it to any other disease out there, right? Typically, when you say gout and I have gout, people tend to look at you cross-eyed thinking, and with a smirk, you must have done something to cause this. Maybe you're eating a little bit too much. Maybe you're drinking just a tad bit too much. Maybe you're not having a balanced life and it's your fault, right? And that's oftentimes how I would feel. And when I would go try to find answers and solutions, of course, you guys know when you look up gout and treatments of gout, you get answers from all kinds of spectrums, right? From, again, home medication, home treatment, home remedies, to somebody that is an expert like Chris, breaking it down, talking about the science of the disease and how we can treat it. So, I'm big on proactively managing gout, not just myself, but Chris and I and GSGA, the Gout Support Group America, is here to offer empowerment to the people that have gout. I want you guys to know that if you have gout, it's definitely treatable, right? Chris's favorite saying, it's doable, right? And that was such an encouragement to me. It's doable. We can manage this disease and we can be pain-free. You know, with all the different avenues out there, it boils down to the numbers and the science, and we'll get into that more. And allow science to dictate your path with gout, and you'll be good.
Love that, Gary. And it's a good segue into a couple of questions for you, Dr. Parker. So, it's really important to see a doctor, typically a rheumatologist. Do you want to talk, Dr. Parker, a little bit about what a typical visit would look like for a patient with gout or who thinks they might have gout?
Yeah, so that would be kind of a first visit, if you will, rather than a follow-up. And a first visit, when somebody comes to me who thinks they might have gout, I tell people I'm doing crime scene investigation. There's a lot of things out there that can look like gout. And so they might think they have it, or they might think they have something else. They might think they have rheumatoid arthritis or some other type of arthritis. And so a typical visit looks like me asking a lot of questions to start with, trying to really understand, what risks they have for gout or some other condition. The physical exam will be focused, at least in my clinic, on the joints that are sick, if you will, painful or swollen or previously painful, that type of thing. And then I generally at that point have my suspicions about what they have. And if I think the problem is gout, that may lead to either blood tests or x-rays or imaging or both, right? Because I want to make sure I really rule this thing in with confidence. And then once I achieve that confident diagnosis, I initiate, therapy right away, especially if somebody is coming in with acute gout, meaning they've got a hot, red, painful, swollen joint. I mean, I start treating them right there and then, even before I have a firm diagnosis. So that first visit could be like, we're going to do diagnosis and treatment all in one day. And then to Gary's point, I'm going to move from that acute problem, meaning horrible pain and swelling, to let's now work on prevention because I do not want this thing coming back. And of course, the patient always goes, "Doc, I don't either. That was terrible." And so then we focus in on follow-ups from there.
That's very helpful, Dr. Parker. And so you talked a lot about, blood tests, imaging. Do you want to kind of walk through all of the different
Sure.
types of tools you have for a diagnosis?
Sure. So I got a lot of tools, and people ask me all the time, whether it's how do you rule in gout or other disorders that I take care of, like, so what's the most important test to diagnose gout? What's the most important test to diagnose lupus? What's the most important diagnostic test to diagnose rheumatoid arthritis? I always say the same thing. The history and physical is the foundation and most fundamental important test that I have, because there are so many tests in the modern world. To Gary's point, it's great to have lots of therapies, but there's so many diagnostic tests out there that sometimes they become distractions on what somebody really has. They'll get some incidental finding that pulls them away thinking they have something else. And so it's very important for an experienced, doctor in the field to kind of go, okay, I have formulated my suspicions about what you have. And then the diagnostic tests that I'm ordering really hone in on improving my confidence and improve my confidence to rule out other things, right? Don't just kind of take a shotgun out. I'm in Texas, so everybody's got a gun, and just like start shooting, right? Because then you get all kinds of tests you don't even know what to do with. So what are those tests? Blood tests, commonly used, and of course, in gout, I'm trying to um, confidently identify high uric acid levels, right? And I can't see that on exam. So high uric acid levels, and it might not be just today, but by the time somebody gets to me, to Gary's point, it might be years or decades. So I'll say, like, bring all the data you got. right? Other docs, they've been ordering blood tests, whatever. I want all that. And then imaging, whether it's X-ray or MRI or CAT scan, ultrasound, each doc has their own favorite tools, imaging-wise, to rule things in. Sometimes I don't even need those, right? But I use what I need to really get that confidence so I can move into therapy and now not spend any more time on diagnosis because we're solid. I don't want people backing up going, is it really that? And I want to spend more time on that, right? So again, reiterating your question, like blood tests, almost certainly, and then imaging if needed, right? That would really be it. Rarely, you might, if some of our members, if they read about putting a needle in a joint and pulling the fluid out and seeing the crystals under the microscope. No, I can do that. But if you said, well, how often do you need to do that? Rare. Maybe 5% of the time. When I'm really worried that the blood test and imaging will not be diagnostic and really allow us to be firm, and I'm worried that this could be an infection because there's so much pain and redness and swelling. And oftentimes in that situation, somebody has like a sore or a cut or an ulcer and then a nearby sick joint. And I go, this could be either thing. And so then I say, like, well, I'm gonna have to put a needle in there and get the fluid out. But vast majority of the time, I don't need to do that. So I don't want patients worrying about that because it's uncommon.
Mm.
So you can diagnose via generally the blood test.
History, physical, and blood test. Yeah. Again,
That's
that history and physical is critical.
yeah.
So I don't skip that part.
And okay, so gout is caused by high uric acid levels.
Yes.
What is considered high? That's a question I think we
I
get
love
within the
that.
Facebook group a lot.
Mm.
Yes. Thank you for asking that. And it's a commonly skipped over aspect of this discussion. Lots of doctors do not understand this. So let me make it clear. It's going to seem surprising, I think, to a lot of you out there, but it's not the normal range that you get in the lab. That doesn't define it, right? Because a normal range, like I'm here in Austin, Texas, if you drive to Houston, 3 hours away, their normal range is different than ours. If you go up to Dallas, it's different. You go to San Antonio, it's different than ours. And you go, well, how's that? And I go, well, a normal range is based on the population of people that live in that area. So if you have 1,000 people, 10,000 people, 20,000 people, if you do a blood test on them, if they don't have any underlying medical conditions, those people are considered normal people, no meds, no problems. And then they'll make a bell curve of that data, take 2.5% off of each side, and you go, that's a normal range. Okay. But, and then that's why Austin's different than San Antonio, because the population of people that live here tends to be a bit younger, a bit healthier, more physically active than my colleagues in San Antonio. And it's, of course, it's made up of a different population. It's just, more Hispanics there. Here we're going to be more Asia. There's, again, the population is a bit different. Now, with that in mind, let me go answer your question specifically now, Josie. The definition of high uric acid is a single number, not based on where you live or your background, but normal human physiology. And that is, the number is 6.8. There's a dividing line right there, 6.8. Because if your uric acid level in the blood is higher than 6.8, and you have some kind of special sauce, meaning, you're genetically prone, that if your uric acid gets above 6.8, you can make those crystals. And they'll settle somewhere in and around joints and then intermittently flare up. So the definition of high uric acid is over 6.8, based on physiology. Doesn't matter where you live. It's same in Anchorage, same in Russia, same in Scandinavia, same in Central America. 6.8 is the number, human physiology. And by definition, therefore, a normal uric acid level, meaning not high, is going to be below that, no matter what your reference range is in your area. If you're a gout person, you have to get below that. And so when Gary and I talk about treatment, and I'm sure you're going to ask more about this, but you have to get below that 6.8. But if you're right on the line, not good, because then, depending on what you eat, you'll be over the line sometimes, under another. And so you're going to be up and down, still having gout attacks.
Thanks, Dr. Parker. I think
Yeah.
that's really helpful. One thing I hear you both say a lot is if it's over 6, you need a fix. I think
Yes.
it's a very helpful reminder to folks of kind of what to be looking for.
I want to say that one again. I'll probably be able to say it. I'm sure Gary will as well. But and guidelines in the United States and Europe, there's agreement that it needs to be consistently less than 6, and that's why Gary and I say if it's over 6, you need a fix, because you need to be far enough below that 6.8 so that you don't have these dietary triggers happening periodically. There's too much good food down here on Earth to start putting X's on all the good stuff, So you got to be down there, or you're going to risk flare-ups.
Thanks, Dr. Parker.
Mhm.
Gary, I want to turn it back to you. You have talked about you've successfully managed gout for many years now. Talk to us a little bit about, how you keep up on that management. How does gout impact you now?
Yeah, thank you for that question. And first and foremost, Chris, I absolutely love listening to you. I mean, I feel like I learned something new tonight,
I'm
right?
glad.
And
I'm still learning.
I love it. I'm like a student of gout, and this is great. When I think of managing gout as a person who has gout, I fall back on 2 different techniques, right? That I think about, that GSGA thinks about, that Chris and I talk often a lot. We call it reactively managing gout and proactively managing gout. I would say for the vast majority of people, even myself, for maybe the 16 years or maybe even longer than that, because I am sure I had unmanaged gout, undiagnosed gout for many years before even experiencing that first gout attack in 1994. So I'm pretty positive I've had gout for a long time. But treating gout solely based on just waiting for the pain to come, right? And that's when you think about gout and the flares here and you think, oh my God, it's so painful. Why does it hurt so bad? Why am I crying, right? Like, what is going on? And then you think about doing everything possible to mediate that pain. Well, that's reactive management. And that's honestly, the vast majority of people manage gout that way. And honestly, many physicians, I believe, treat gout that way. They'll give you pain medication just to treat the symptom and then send you on your way with a flyer that says, don't eat that, don't eat that, don't eat that, and put the focus on the patient to manage themselves and help themselves. The most effective way, and what we talk about, is proactively managing gout. And if you can picture, like if you live in the forest and it's dry, that there's going to be maybe fire seasons, dry seasons. There's going to be times when we're going to have high expectation of fire. So what do? Do you wait for a fire to come on? No, you're probably going to do some proactive things to fireproof your house, right? That's kind of how I think of proactively managing gout. Understanding what causes gout, like Chris was saying so elegantly, the high uric acid level within your body, if it's over 6, basically your body starts to get to the point where it's saturated and your body produces crystals. And with time, when it's at that level, you're going to produce enough crystals where it will cause flares. And to proactively manage gout, that's it. You just need to understand that simple concept. And then in layman's terms, you do everything you can to get that uric acid level below 6.8, not just below 6.8, but well below 6.8. I use a at-home meter along with just, Chris is still my rheumatologist. And nowadays, we do blood treatment once a year so that he can see where my levels are at. But I remember in the early days, we were doing it like maybe once every 3 months or so, just to kind of understand where I'm hovering at and how aggressive we need to be with my treatment. There are at-home meters now that we have, Josie, right? We can go and prick our finger at home with a little blood. We can get an understanding of where we're hovering with our uric acid level. Well, I can tell you, once I started proactively managing gout and understanding the disease, I do whatever it takes to keep it as low as possible. So Chris and I have come up with a regimen for myself. And everybody's going to be different, right? Because our body types and whatnot. So dosage with medication will be different. So I've been on allopurinol, and I'm currently on the generic version of uric, which is febulistat. And I don't mind telling our group that for myself, I take 80 milligrams per day, every morning, religiously. And I know where my uric acid level is at. So in short, I run an average of about 3.7 or so on the Richter scale, right? The uric acid scale. So with that said, I know that I can go in the backyard and do an 8-hour brisket, right? And cook that baby up and feast for a week and be okay, right? Because I just know where I'm at. So I can consume what I want. I can eat what I want. I have the freedom to live and love life and not to live in fear. And that's where we all need to be, and we can be, with proper medication and proper techniques of managing gout. So I hope that makes a little sense. So basically, proactively managing gout is the key.
I love that, Gary. That kind of proactive approach and the way that you both talk about this, because not every disease or condition is like this, where you can, get treatment, where there's treatments available, where you can know your levels, where that's, to your point, there's at-home tests even where you can keep track of how you're doing. That's not always the case, and so there's a lot of hope, I think, in knowing that. Um, so, Dr. Parker, Gary talked a little bit about some of the treatments he's taken.
Yeah.
Do you want to walk through for the audience just kind of what treatment options are available for gout?
Sure. Happy to. And this is one of the most common things that gets brought up in the Facebook page. They people want a strategy of some kind. And so, to Gary's point, I want to highlight something that I think a lot of our members struggle with. About, he's a self-proclaimed foodie. He's going to make sure he still gets to enjoy a life. And I love how you said and not live in fear, meaning a fear of a gout attack. I mean, that's no way to live. So I want to talk just for a sec on trying to solve this with diet alone. Let me just make it easy for you. It's not going to work. It's not going to work. I know you want it to work. I know your family wants it to work. I know your spouse wants it to work. But the long and short of it is, if you have the stuff that makes it so your uric acid is high and you have these intermittent flare-ups, nobody's going to be able to navigate for the rest of their life some austere diet that would be not even fun to enjoy. I've got professional athletes in my clinic. I got Olympic athletes in my clinic, and these are very disciplined people, and they themselves will say, really? Like, never? And so it just doesn't make sense. So I tell people, just do as good as you can with nutrition. The best, and is, the better you are at that, probably the less medicines I'll need. Everybody needs a custom fit of whatever medicine we're going to try to use. And I've got several. The most common by far are two. One Gary just mentioned, allopurinol, been around for a long time. All it does is just a pill that's very inexpensive. It's not over the counter, it's a prescription. Very inexpensive, even if you have no insurance, like $4 at Walmart, right? All it does is just inhibit the enzyme in our body that makes uric acid. So if you take a certain amount, you'll make less uric acid. If you take more of allopurinol, you'll make even less. And so I custom fit the dose for everybody, right? Now, nobody wants a one size fits all, because one size does not fit all. There's great diversity in the world. So a number of years ago, probably more than 10 now, I don't remember exactly, 15, probably 15, we got another pill that works on the same enzyme but differently called uric. It's the brand name. Now it's generic also. Febuxostat is the name. It's also a pill. One pill once a day. The same thing. I'll adjust the dose so that somebody gets their uric acid consistently in that sweet spot between 2 and 5 is my usual target. So that way I'm well below that 6. Because if you're over 6, you need a fix, right? I don't want to say that often tonight. So I got them in that little bullseye. And then every day that they take their medicine, the uric acid crystals that had accumulated in their body, perhaps over a period of many years, gradually dissolve away. It's just like dropping rock salt in water. You don't have to stir it. It'll dissolve as long as that water is dilute. So I make their blood dilute, uric acid dissolves away. How long does it take? Well, how big's the rock salt? If you've been making this stuff for 10 years, it's going to take me some time. If you just started in the last year, it's going to take me a lot less. Okay. Now, a couple other meds for completeness. There's another pill that's also inexpensive but rarely used throughout the world called probenecid. It's not that it doesn't work, it does work, but the reason it's rarely used is because to get that uric acid lowering effect, you have to take it twice, if not 3 times a day. And so it gets hard to keep up with because the other meds are just one pill once a day. So you can see simplicity being a factor here. And that's why probenecid is rarely used, but it's an effective therapy. And then last, for people that have really accumulated a lot of uric acid in their body over a period, often many years, and they might even have bumps that you can see under the skin. They're called, a single one is called a tophus. If they've got multiple, they're called tophi, is plural. So if they've got such an accumulation, and I'm trying to use the pills not adequate, meaning it doesn't get that uric acid into the target range, then I have an IV medication that I'll use temporarily called Cristexa, or uricase might be another way to say it, but that's a once every other week IV infusion that people generally only stay on for months because I can lower the uric acid so effectively that what would take me years to do with pills, I can do in just months. And so I really clean the house, as Gary and I like to say, with a medicine like this. And then when the house is nice and clean, then I put them on the pill for maintenance. So that way it never gets dirty again with all that uric acid crystals. Those are the main therapies to lower uric acid. The only other ones I'll mention much more briefly is when somebody has an acute attack, meaning a flare-up, pain and redness and swelling. I have medicines to bring that pain and redness and swelling down that does not lower uric acid. Most people know some of these. Anti-inflammatories like Aleve, Advil, Motrin, there's bunches of prescription versions. Anti-inflammatory steroids, that's prednisone. And then colchicine is a pill also that is an anti-inflammatory, but it's neither of those, meaning it's not a steroid and it's not an NSAID, an Aleve, Advil, Motrin. Those are going to be your most common. Everything else is going to be, I've got a few more anti-inflammatories, but they're rarely used, so I'm not going to get into those in detail unless there's questions at the end. That's my
Very
whole toolbox
helpful.
right there. Yeah.
I love it, Dr. Parker. So if I can attempt to summarize and you tell me if this is right.
Yes.
So there's two categories of medication here, really. So there's one kind of category of let's treat the flare, you're in pain, let's
Yes.
bring down the inflammation, let's address the pain. But equally as important, more important maybe, is this uric acid lowering
Yes.
medication. I think that's the one that gets forgotten sometimes in the pain of the flare,
Absolutely.
that ultimately you have to get to this other category.
Right, Josie, and that's exactly it. And really, to Gary's point, when this is really hurting like anything, of course you'll have one thing in your mind, reactive. And we're not saying that's wrong. That's right. You got to get that pain down because it's horrendous. But once it is down, you got to move to proactive or it's coming back. And then to Gary's point, which I loved, him saying tonight, because I don't think I've really ever captured it like you said tonight. I don't want to live in fear. This thing's coming back. If you don't take a proactive approach, it is coming back and you don't know when.
Mm-hmm. So, a question maybe for both of you. So we've talked about kind of the medication options. One of the questions we see a lot is home remedies. What, does that work? Can I just do home remedies? Do either of you want to talk through that?
I'm going to
Well,
let Gary talk about
yeah,
some of the specific ones, and I'll just give kind of my doctorly thought about home remedies.
right.
So
So,
I'm just going to give my thought, and then you can give the specific home remedies that you talk about. But to me, I have a very simple mind, and I go, listen, if I am treating a condition that's going to resolve on its own anyway, then anything I put in thinking that it's going to work, my brain is going to say, yep, that worked. And I can't argue it because they're like, well, it was going to go away anyway, because gut attacks go away. So if you say, well, if I eat Kool-Aid or if I drink Kool-Aid, that's going to work. And I started drinking Kool-Aid. 5 days later, it was gone. Worked. Antibiotics. 5 days later, gone. Put a copper bracelet on my wrist. Worked. Gout's gone. And so be very careful that A caused B. But the problem with home remedies is when you start testing them, you kind of go, well, they work as good as all the other ones, which means, they work as good as my coffee that I'm drinking, right? I mean, it's going to go away anyway. So with that, I'm going to warm it up for Joe or for Gary to now weigh in on some specifics.
yeah, absolutely.
You
When
tried
I
everything.
think of, right, I think of home remedy, I still remember first meeting you and I was talking about my home remedies and I was talking about what I've been using, the most famous, and we all know this as gout patients, people that live with gout, cherries, right? It's just the thing that people talk about all the time. Cherry juice, cherry extract, cherry this, cherry that. The darker, the better, right? My dad got me these cherry extracts that were like deep black, potent, and he was so proud, and he did out of love, right? Love. And I remember coming to you with that, and I like what you said back then, and I'll say it again. You didn't, encourage me to stop. You just said, add it to the repertoire, and use it with the medication. But when you think of gout, I said it before, it's very scientific. It's all based on the numbers. So now looking at diet, because Chris and I and the Gout Support Group of America do look at diet. It's a very important thing. We're both fit people. We take, health seriously. I talk about eating all the time, but I'm actually very healthy, right? And I keep that mindset. But diet alone only moves the needle. And this is important to understand. It only moves the uric acid needle by an average of 1 or maybe 1.5, right? So think about this. If you as a gout patient average about maybe 8 or maybe even 9, I remember when I was diagnosed, I was 10. My level was 10, right? So if diet would move the needle up or down. So I can eat more meat or I can eat less meat or whatever. But let's say I'm at 10 and I'm eating great and I'm like an athlete now and I'm eating nothing but wood. I don't know, like you can't eat anything, Like let's say you're not eating anything. You can drop your uric acid maybe to 9. Maybe at the best you can go to 8.5. Well, where are you? You're still way above the 6.8. Right. And even if you were maybe at a 7.5 and you're trying to do this by the book and by diet alone, well, maybe you're dropping down to 6.5. You're 0.3 under, and we're talking about just for that day. We're not talking about a running average. And what if you want to go out and celebrate and have a steak? Where are you at? So think of it that way. So diet for those that are blessed with the genes to produce a lot of uric acid, it is not effective. And this is just based on the science. No, I don't want to talk down about those that are wanting to focus on diet, because it's important. It's important, but we have to understand the limitations of solely using diet to manage gout, because at the end of the day, it has serious limitations. But take diet with the medication, you're going to be healthy, and you're going to be in a good place, a very good place.
Right.
Mhm.
I think it's a great point, Gary. So diet it's a part of the puzzle, but it's not the whole thing.
Right.
You need that comprehensive, proactive approach. Dr. Parker, I want to go back to something you talked a little bit about, and I'm hoping you can just expand on this a little bit. You talked about, the sooner you can treat gout, the better.
Mhm.
Can you just talk a little bit more about that? Why it's important to treat
Yeah.
when you first feel like you have symptoms versus waiting, a year or 2 years, 10
Yeah.
years.
Well, I'd love to talk about that. And I think about the word insidious. I don't know if any of you guys ever use that word. It's a great word. So things that are insidious sneak up on you like a snake, right? Below the radar, getting into your, inculcating into your life and your ability to do things. And so gout is just as is not only insidious, but sinister, meaning bad, right? Because those crystals that Gary and I have been talking about, if you looked at them under the microscope, which of course I've done a million times, they look like little needles. And if you wonder what little needles can do when you're not flaring up, let me help you. They can erode through bone. They can erode through cartilage. They can erode through tendons and ligaments. And they can land anywhere in the body, in the organs. I got a picture of gout crystals in the eye, literally the eye, right? Anywhere where there's blood, they can land. And so if it's happening slowly, it's kind of below the radar, so your immune system's not really seeing this. They can lay these crystals down in places and not flare up, or only flare up intermittently and rarely. Like, oh, my last flare up was a couple of years ago. And they come in, they got these big old knobs, right? And so when people come to see me and they're like, wow, I don't really, I'm fine right now. I mean, I'm not having a flare up right now. I don't feel it right now. I go, well, but the thing of it is those crystals are still there. You're still walking around, and these things are just slowly eroding into bone and cartilage and stuff while you're doing your daily life, right? So I don't want you to sit on this thing. And so I'll use an analogy that most people understand about their teeth. I go, listen, you could not brush your teeth, you quit, and you would run into troubles right away, right? But think about it. When weeks become months or longer, gingivitis, meaning your gums get sick, cavities, bad breath, don't taste right, film on your tongue, just a mess. So you don't want to wait. And if you show up if I was a dentist, you show up in my office with a bunch of cavities, I go, you got to start brushing. And they click, got it, right? You don't want this to keep going. And the earlier the better, to your point here, I think, Josie, and that is, that's why you don't want to wait, because stuff is happening between flares that you don't want.
Mm.
Very helpful, Dr. Parker. So thank you for talking about that a little bit.
Mm.
And a reminder that if you have a question and you're on Facebook, feel free to drop that into the chat. You could drop a question if you're on the webinar via Zoom in the Q&A box, and we'll get to those. But before we do, I guess a question for you, Gary. If you're offering kind of your best tip for someone who has not, thinks they might have gout or knows they have gout but hasn't started treatment, what's your number one piece of advice?
I think I would say find your voice, right? I want you to feel empowered to find your voice. Oftentimes, people that have gout, we downplay our symptoms, right? Because we don't want to cause trouble. We don't want to stand out. We don't want to admit that we have gout, especially maybe if you're young and you possibly might have gout. You don't want to accept the fact that it could be gout. The fact that if you have 2 or more attacks per year, you're basically in the chronic gout, category. I don't know if people even realize that. I certainly didn't. I had way more than that, but I wouldn't back then considered myself in the chronic gout category. So I think first and foremost, gout patients downplay the severity of their sickness. Secondly, like I love what Chris is saying, just because you're not feeling gout doesn't mean it's not actively working against you. It's always moving forward or it's moving backward. It never sits there. It never goes on vacation. It never says, hey, I'm gonna take a time out because I'm tired. No, it's moving forward or it's moving backwards. And then I would say, ultimately, you manage gout or it's going to manage you, right? So you have to become this proactive person. You have to own your health. You have to really go out there and demand a diagnosis. If you know that gout runs in your family, like I knew, my dad told me at 24 years old, after my first gout attack, he told me, he says, gout runs in our family, go to the doctor. Well, the doctor didn't listen. The one thing I wish I would have done different back then was I wish I was more confident in myself and in that I was able to find my voice. I just put too much stock in what that doctor was saying. And I really wanted to believe what he told me, which was I was too young to have gout. And I wanted to embrace that. And ultimately, like Chris says, when a flare comes on, you don't have to do anything. The pain will leave. It'll go away. But it's a proactive disease, meaning that it will become worse with time. And if left unmanaged and untreated, the attacks will come back more often and more severe each time. Right. And that's exactly what happened to me. 1 year turned into 2 years, turned into 5 years, turned into 10, and all of a sudden, I went from 24 to 40 years old before I was able to get that first diagnosis. So please learn from my experience. I'm here because I want to pass it on to our members and those that have gout. Find your voice. It's okay to seek a second opinion if you think that doctor is not treating you effectively or giving you the proper the proper treatment, right? The service, quality of care is a real thing. So, and if you have gout, you're just not alone, and there is hope. Okay.
Mm-hmm.
I love that, Gary. I think a lot of really, really good and important advice in there. And I will give Gary and Dr. Parker a huge shout out. So if you have not visited the Gout Support Group of America's website, please do. There are so many really important resources that you can find there about how to talk to your doctor about gout, what questions to be prepared to ask, how to seek support, pieces of that gout journey that are really important. And so GSG has developed a ton of resources that are really aimed at making sure that you can find your voice. Okay, a couple of questions that have come in via email and through the chat. So the first one I wanted to ask, I think this is really probably for you, Dr. Parker. So one of our members wrote in and said, I feel like I'm working hard, doing a good diet, I'm taking my medication, I'm checking my uric acid levels at home. My uric acid has been under 6 for a few months, but why am I still having flares?
Yeah, I'm glad they asked because oftentimes it's not only frustrating for the patient, but counterintuitive, meaning they think by achieving that low uric acid that they should stop having attacks. And I go, well, they're right with one caveat. You will stop having attacks when those crystals are gone, right? And so that's critical, because if you said, well, I start, like in Gary's case, 16 years of gout before he sees me, how fast do you think I can fix this, right? You mentioned in your case, Josie, here, like they've been low uric acid for a few months. I go, well, to me, that didn't sound that long. So let me now give you actual data. So there was a really wonderful study done to answer the question, how long does it take to stop having attacks if we do it just like you said? Meaning, I do my best to have diet, I implement a pill like allopurinol, and then I get that uric acid level consistently less than 6. As soon as you achieve that, clock starts, or the stopwatch starts, click. And then we start asking, okay, how long is it going to take? And what was found was within 6 months, about 80% of the people quit having attacks. 6 months. And you go, oh, that's good news. So really, I got 6 months, and many docs will overlap their allopurinol with another anti-inflammatory to help prevent attacks during that first 6 months, because they want to make it so that people are less likely to flare up when we're trying to, as we say, clean house around the Gout Support Group of America, GSGA. We want to clean house. And while you're cleaning, you can still have attacks. So we don't want that. Now, if you go, well, what if I'm like Gary and I've had gout for a long time before I ever started these therapies? And I go, well, then you're like that other 20%, that they need another 3 to 6 months to be successful, right? And so the good news, at least in that study, is everybody hit the target, but some took like a year. So don't lose hope. Gary and I have been talking about that all night, and Gary's been really good at saying, like, there is hope here. You can get there. It may take you a little bit of time. And I'll say that there's one other group of people that one has to think of, and that is, well, what if the allopurinol doesn't get my uric acid all the way into that sweet spot? And you switch to a different pill, and that doesn't do it either. That's where I use that IV medicine called Cristexa. Way stronger than any pill. And so that then I can really maneuver. But when it's all said and done, and then the house is clean with that IV, I switch them back to pill and hold them. Right. So everybody is going to get there. But those flare-ups can still happen until those crystals are gone. So don't lose hope, and don't stop your medicines. Because it sounds like, who's writing in, you're going to make it. You just need more time.
Right. And I would say this too, just from that comment, she said what she's averaging maybe 6 or so, with her medication, she's hovering around 6. To me, and again, I'm not a physician, but in my book, I'm thinking she's basically straddling that
Yeah.
fence, right? It's
Too
not
close to the
low
line.
enough. It's too close. You're basically walking that tightrope, right? Because you're too close. In any given day, your uric acid level does fluctuate, right? And so if you're at 6, you can fluctuate high, you can fluctuate lower. Now, if it goes over 6.8, then the clock stops.
Yeah.
Right? It stops.
Mm-hmm.
And now you're accumulating crystals again, right? So you want it not just below 6. I think we need to restate this. It needs to be well below 6. And you need to probably find a doctor that is aggressive enough and have enough confidence to give you the proper dosage to get you to a point where you can actually live like a human being. Because really, if you're averaging 6, you're probably not living like a human being. You're constantly living in fear.
Mm-hmm.
Really, if I'm walking a tightrope, I'm in fear. I'm in fear, right? So
Yeah.
I want to point that out.
Thank you both for that. Another question, one that came in from the Facebook group chat. Can anything be done to resolve tophi in my fingers? So, we're talking about someone who hasn't had a gout flare in years, takes 100 milligrams allopurinol. Anything that you can offer on kind of the tophi resolution?
Yes. So definitely the tophi can resolve, and all that means is those crystals dissolve away. Again, the analogy I like to use is dropping rock salt in distilled water, right? Importantly, and again, I'm still going to pepper this with hope, but I'm going to put the cards on the table and be honest here. So if somebody has a tophus the size of a marble, so let's say it's just a normal size marble, maybe about that big or round. If the blood has a uric acid level right around 5, it'll take 2 years to get that tophus to resolve. And you go, oh man, 2 years? And I go, yeah, that's a big accumulation. It's just a little rock. And so what if it's even bigger? And I go, whoa, it's going to take longer, right? So number one, I don't want you to lose hope. It will dissolve. But you need to constantly have that uric acid level under control, to Gary's point, and people that have that degree of gout where I can even see under the skin, the lower the uric acid is, the faster those crystals dissolve. So my target for my people with tophi is not necessarily between like 3 and 5, but it might be more like 2 to 4. Or if I'm using Cristexa, it's less than 1. Because again, I can clean those up so much faster. And I don't want to, when I'm sick, I don't want to wait 2 years to be unsick. I want to be as unsick as fast as possible. So I adjust my target uric acid based on how sick they are. So when Gary came to see me, he was pretty darn sick. So I did have to give him Cristexa. And then I have to give him a pretty good dose of allopurinol or Ulor to do the job, because he's got the same genetics that someone else has that makes a lot of uric acid. My family also has gout. As far as I know, none of us have tophi, so we probably don't need quite as much medicine. Hopefully that makes sense. Custom fit the dose, that's it. But you can get there.
Thanks, Dr. Parker. And one question that I want to address, and we'll drop a link in. Someone says, I'm here on behalf of my son, not treating, his gout right now, because he's worried about his kidneys, having multiple attacks. Can I have access to this presentation? So the answer is yes. We are going to drop the link to GSGA's YouTube page in the chat so everybody can see that. The video will be posted there. There's also a number of great video resources that you can share. But thank you to everybody who's come on behalf of a loved one, because
Yeah.
Sometimes it's hard to seek treatment, and so family members coming is really important. We see this a
And
lot
common.
in gout. Yep.
And common. Thank you for that, Josie. It's common. Because these perceptions are, well, it's going to go away anyway. Why do I have to be proactive? And the answer is, as to Gary's point, you're going to live in fear. So you need to be proactive here. And that the other thing I'll say about loved ones trying to understand someone's gout, the value of our YouTube page and these discussions is there's lots of examples to help people who don't have gout understand not only the disease, but how painful it is, because you'd be shocked to find out descriptions of what people describe. And it helps employers and coworkers understand, like, this is not small potatoes. This thing will change your life and all your priorities when you're having an attack. Right. So we encourage people to go there to get valuable information. Nothing is for sale. Okay. We're not selling anything. It's just information because we want people to do well.
Absolutely.
Right.
Thanks for that. I know we're coming up on time, but a couple more questions. So allopurinol versus Uloric, had a question that came in. Someone who did take Cristexa, did great, got their uric acid levels down, has been on Uloric, and now is dealing with some insurance issues. So making the switch, at least for now, to allopurinol. Can you talk a little bit about the differences, Dr. Parker?
So each medicine has its own pros and cons, like all meds, right? And the main thing you have to attend to with allopurinol is you have to dose it, not just to get the uric acid controlled, but a lot of times people with gout have some kidney function problems. And so you have to factor that in to the dosing scheme. kidney function and uric acid. The medicine plays nice with others. I mean, it gets along with other meds, so that's not really a factor. It's really just kidney function, uric acid. So let's say somebody, in spite of using the allopurinol, they just can't get that uric acid in the sweet spot, or they can get their uric acid down, but I mean, their kidney function just is not good enough to safely use allopurinol. Well, thank goodness we have Uloric or febuxostat, and it is, you don't have to have near as much adjustment when it comes to kidney function. You can have pretty bum kidneys and still use the Uloric or febuxostat. And it's an effective therapy. It lowers uric acid well as well. But to the person writing in, it's a more expensive generic. And so that's a factor, right? Now, some people can just buy the stuff cash. That you go to GoodRx and use the coupon, and they go, "Oh man, I could get like 3 months for $80 or something like that." And they like, that's not going to stretch me too thin. But sometimes that's, it's a lot of money for some folks. Like, so I can't buy that. I got to get allopurinol. That's $4. So each one has its pros and cons. Rarely will a medicine like allopurinol or Uloric cause headache or nausea or rash or something like that, but it can happen. And if that does happen, of course, then you can't use that one at all. You're going to have to use something that, the alternative, the other one, because you can't tolerate one of them. Hopefully that helps. So you got to let people
Mhm.
find the one that's going to be the best fit for them.
Absolutely. And one last question. I know we're coming up on
Mhm.
time here, but uh, Dr. Parker, you talked briefly about this. How does gout impact the eyes? Since you
Yeah, the
talked about
eyes.
kind of the crystals.
Well, I think the important thing to understand is gout is a systemic illness, meaning any of the organs can be afflicted with gout, meaning those crystals can land there. Okay. People always think, oh, it's a joint disorder. And it is a type of arthritis when it affects the joints. But I want our listeners to understand that it can get into any organ. Uric acid can cause kidney stones. Uric acid can, clog up the tubules and make the kidneys not work. It can affect liver functions. It can get in muscles. It can tear through, tendons. And I've never seen somebody have a gout attack in the eye, but they've basically developed a tophus and that impaired vision. That's the picture that I have. And those tophi can land anywhere. So I don't want people to think it's only a joint illness. That wouldn't be true. It's a systemic illness that commonly affects joints. Now that's a more fair statement.
And it can affect the spine, right? The
Oh,
back. I
absolutely.
mean,
Mhm.
just everywhere. More
Heart,
places than you would think, right?
the heart.
Yeah, the heart.
Mhm.
Mhm.
Yeah. So basically, the sad news is here, if you're not going to be proactive, people that if they age match people and match them for other disorders, diabetes and hypertension and stuff like that, and you look at these two groups, the people that have that stuff and gout, they die faster than the group that has that stuff but no gout. So you're going to want to treat that gout, right? Because it can shorten your life.
Mhm.
Mhm. It's not just
Mhm.
the flare. It's
Thank you,
I
Josie. That's
Mhm.
exactly it.
Yep,
It's not just
Mhm.
Blair.
absolutely. Well, thank you both. I think this has been extremely helpful.
Yeah.
Hopefully, extremely encouraging to folks who are considering going into a doctor or thinking about treatment. With our remaining minute here, would ask you both. I mean, I guess any closing thoughts for the audience.
I'll give one and then let Gary go because he did a real good one and a few last time, but I just want to do one. Check your levels. Don't try to think you know gout without checking your uric acid level. You don't know unless you check that number. You got to get the blood test.
Mhm. Yes, absolutely. And I am going to say just a couple. I want you guys to know that you're not alone, right? You're just not alone. There are 9 million and more, way probably north of that in at least America with gout. So you're not alone. There's power in numbers, and and I just want you to know that living with gout and being in pain free, that can be in the same sentence. And it's very doable. Look at me. I was the worst case. I was the worst of the worst, I'm telling you. If I ever get an opportunity to share my pictures, right? I took pictures through my journey. You can see, where I was when I was trying to reactively manage gout and when it was just out of control, and how bad my body was suffering versus now. And you can see me now. But I am telling you, I was a wreck. I was a wreck. And I know I wasn't alone. So the Gout Support Group of America is here for you guys. We're not here to make a buck. We're not here to sell snake oil. We're not here to give false hope. We're here to just ground you, right? Just bring a little reality to the situation, mixed with some hope, right? And that's who we are and what we're about. And it's good to be here with you guys.
Yes, thank you, Josie, for helping us.
Fantastic.
Thank you.
Thank you both so much for sharing your time, sharing your expertise. As we said, this video will be available on the Gout Support Group of America YouTube page. Would also encourage folks to check out the goutsupportgroup.org for more resources, more support. Check out the Facebook. And truly just thank you to you both, and thank you to our audience for taking the time.
Thank you. Thank you, Josie.
Thanks,
Thank you
everyone.
all.
Have a great night.
Bye.
Bye-bye.
Good night.